Welcome everyone to our Tuesday night chat. I'm your host, Kelly Wilkins from My Self-Reliance. It's so good to be with you. Tonight we have a special guest, Genevieve. So good to have you here, Genevieve.
Thank you, Kelly. Thanks so much for inviting me.
My pleasure. And before we jump into Genevieve's conversation, just want to give you all a little bit of update where we are with our Freedom Summit Live coming up in October. You do want to get your tickets because we have put together an amazing lineup of speakers, workshops, and activities for the whole family. It starts on the 18th of October through to the 20th. But you can come in on the Thursday. You can set up camp. You can stay until the Monday. So we've really made it a really great weekend away. So if you don't want to stay camping, you can stay locally, or if you live locally, you can just come each day. Tickets start at as little as $200 for the whole weekend, including all the activities. There will be food options available on site. You can also cook your own. There'll be places for like washing up bays and also some cooking facilities as well. And so we really love you to make yourself at home there. We have also opened up. Now, let me tell you a little bit about the itinerary. The Friday day is really all about you. It's all about upgrading, releasing burdens, looking at the world in a new way so that you can step out of the old and into the new. And then we move into day number 2, where it's all about upgrading our skill base. And when we upgrade our skills, we increase our confidence. So you can increase your confidence in so many ways on day 2, with living in private and ancient weapons, and Pete, who's talking on emergency prep. There's so much going on, including Serena Tapaha, who's coming to speak, and finishing off the day with a barn dance. So family friendly. I'm so excited about that. And then we move into day 3. Day 3 is a really great way to connect. So if you haven't had a chance to connect the other days, day 3 is going to be all about looking at how we tackle the problems, the real world problems that we see, with real solutions. And we've got Dr. Pran Yoganathan speaking on that day. You will love our regenerative farming talk from Pepe, and we're going to do a bit of a game show on Sunday, where we'll be able to role play. That's probably an interesting word for it, but you'll be able to really get involved on some of these solutions-based activities. Then we're going to finish off the day with a spit roast from Country Meats Direct. And we've got so much. That's just a little snippets of each day. You really need to go to the website for the full rundown for what's happening. And we just invite you all to come. So we are opening up Sunday day tickets, and also the bush dance. So if you know anyone who's just really mad keen on bush dancing but doesn't really want to participate in anything else, then they can just come along for that. And that's super, super fun as well. Alrighty, now into our topic tonight. Let me just invite Genevieve onto the screen. Genevieve and I met recently at one of our freedom gatherings in Winston Hills, and I just love Genevieve's story the moment she spoke. As a naturopath for 19 years, she has just been helping people at all levels. Tonight we're going to touch on these way that she diagnoses and helps people through all these, the AdHd and the ODD and the autism spectrums. We're going to talk about infertility. There's so many different health aspects, but also what we couldn't say and that everyone wants to know about is the live blood analysis. So first of all, Genevieve, let's start with telling us a little bit about yourself. And I know that you've got a slideshow for us, so maybe I'll just hand it over to you and I'll let you take it away.
Okay, perfect. So share the screen now.
Yes, that's good.
There we go. And that's the full screen. Okay,
Perfect.
fantastic. So hi everyone. I'm Genevieve. My background is my mum. She had cancer, like terminal cancer, from when I was about 5. And she beat her first terminal cancer, which is fantastic. She did lots of juice fasting. And I guess the really cool thing about these freedom groups is my mum and dad used to talk about Big Brother, about, all of this conspiracy theory, I guess, stuff, as people refer to it, back in the 80s. They grew their own pot in the backyard. There was all of this kind of community stuff going on. So I guess for me, I've not ever known any different than questioning everything that we've been told. And then another really cool thing is, just the lesson to be taught by your parents to not believe anything that you're told unless it kind of sits well with your soul, and to question, the information coming in. I'm a naturopath. I always wanted to be a naturopath. I discovered my passion at 16 to become a naturopath from one of my teachers, and started studying at 18. And thankfully in the 90s, the lecturers, the doctors, the nurses, the naturopaths, nutritionists were all anti-vax, all openly spoke about how their children weren't vaccinated. And you're allowed to do that in the 90s. Like, you could get away with telling the truth and being honest about that. So my kids have never had a vaccine for anything. And so I guess with all of the COVID stuff and all of this new stuff that's come through, it, was a no-brainer to not follow what I guess people were doing with it all. But I'm going to hopefully, I clicked on the next slide. Oh, there we go. So that's me and my boys. That's a bit of an older photo. They're now 13 and 15. And the cool thing about the 15-year-old, lots of my patients get concerned about sending their kids to public schools, and will they be brainwashed? Will they buy into the agenda? Cadell recently had an exam, and in the exam they had a trans question, and he refused to answer the question as a protest. So what I will tell people is, your kids will make up their own minds about things, but to encourage them to think for themselves instead of just believing what they've been told and what kind of the education system's telling them. They don't have to believe that, and they don't have to follow that path as well. So that's mum. She passed at 60 from her last cancer was terminal endometrial cancer. She was experimented on when she was 3. They used to irradiate the brains of babies at Westmead Hospital because they wanted to see the long-term effects of x-rays. My grandma was paid for the treatment, but being a farmer's wife, she didn't think to question it. And then mum kind of, I guess, had her first benign cancer in her late teens, early 20s, and then the stage 4 breast cancer in her late 20s. She went on to have brain tumors and melanoma. She had all the skin taken off her back, and then she passed at 60 from stage 4 endometrial cancer. But she did a lot of juice fasting, meditation, a lot of natural things over the years to work on it. And then in the end, I think people do get to a point where you've been fighting cancer and working on it for so many years that sometimes it's easier just to have an acceptance and let go. And I think that's what she was ready to do in the end. So these are actually case studies of fertility patients, which may or may not be relevant because we were talking about, oh, okay, so this is a picture of live blood. So we're not allowed to advertise that we do live blood. However, I was talking to Kelly today about this. There's a lot of misconceptions about live blood online, and lots of my friends are like, oh, everyone that's had the COVID vaccine has these abnormal cells in their blood, under live blood. It's not true. The thing with these abnormal cells is that a very small percentage of people that have had the Pfizer, I've noticed these abnormal cells in their blood. I've noticed green cells in people's blood, which I've never seen before, and I've noticed cells that I've never seen previously. Now, we don't know what these cells are. The ingredients of the vaccines, we don't know what they are because you don't have to actually say what's a delivery system, the heavy metal that delivers a vaccine into the bloodstream, until 10 years after it's been produced. So for most vaccines, we know that they use mercury or aluminium. However, this one, we don't know what the delivery system is. So we can detox heavy metals. I also use the CEASE protocol, which was developed by a Canadian doctor to reverse vaccines. So we have the CEASE detox, so Pfizer, Moderna, AstraZeneca, and then childhood vaccines like MMR, DTaP, all of that kind of thing.
Genevieve, can I just ask you a question? So when someone comes to see you, do you take their blood and look at it there and then, or do you send it off? How's that process?
I look at it. So I've got, let me see if I can kind of turn it. I've got a microscope just sitting on my desk there. You can kind of see that. So I look at people's blood right there and then during the consult. So if someone comes in, we can have a look. We can go, you've got a parasite. It's probably why you've got the symptoms going on. You've got a B12 deficiency. You've got low iron. You've got inflammation, autoimmune. We can see a lot of that stuff immediately. So that's very cool to be able to look at people's blood straight away. So we can, without having to wait for blood tests. I'm a big fan of doing blood tests, and I do send people away for blood tests because we can see some really interesting information. And what I do see is if people got a Pfizer, you can see the before and after in their blood tests if it was a real Pfizer, because what I suspect is a lot of people got saline because a lot of people had no immune reaction, no symptoms, nothing after they had a Pfizer. Lots of people did. So if people had symptoms, then there's a good chance they got a vaccine. We do see changes in ESR after the Pfizer. These turbo cancers, we can see that the ESR, which is long-term inflammation, was normal. They had one Pfizer, and the following blood test, the ESR, which is long-term inflammation, is through the roof. Obviously, people have to have a susceptibility to these turbo cancers. There's so many factors that go into cancer, as well as the emotional side of things, because if you've had trauma, you're holding on to trauma, your cells are susceptible to damage from a vaccine, from parasites, from stealth infections, viruses, that kind of thing. So your cells can be damaged. You can develop disease if you haven't addressed and treated and released whatever the trauma is. The other thing about information with vaccines and damage is, if anyone's looking for a great book to read, there is a brilliant book. He's one of the world leading experts on genes and how vaccines affect you. Sorry, I've just been talking to a patient about it today, so I've got it sitting on the floor. So that's Dirty Genes, and that is by Dr. Ben Lynch. So I guess if people understand the way their genes work, they understand susceptibilities. people can even make informed choices about if they ever get a child vaccinated because of their genes and the chance of them developing autism or ADD or ADHD or whatever it is as a side effect from that particular vaccine. So I guess if they know the genes are there, they can make those decisions. So yeah, that's always exciting. I've got another really cool book called The Vaccine Friendly Plan. And it's by Dr. Paul Thomas. I'm just looking, I can't, it's not just jumping out at me right this second. Basically, in his clinic, he has a delayed vaccine schedule, and he's had no new cases of autism since following this delayed schedule. So he put together his own schedule as a pediatrician. And one of the things he talks about is no vaccines in pregnancy. There are no safety studies on vaccines in pregnancy. And a lot of doctors that I know, if the one thing they avoid is doing any vaccines in pregnancy, that's like a really important factor there. But certainly ADD, ADHD, the main cause of that for a lot of kids is the DTaP. So that's the diphtheria, pertussis, tetanus. It's listed as a side effect. And if they've had that, it's a problem. Now, lots of kids.
What age that's given?
The first time that's given is at 2 months. So unless you're videoing your child and you've got video evidence to see changes in their attention, in their eye contact, perhaps in their hyperactivity, you may not pick up that that's been a trigger for your child because you may not have been monitoring it and been aware of that. The other thing is, and this is an interesting one, this is a Sydney pediatrician, I won't mention his name, but he's told many of my patients that he actually believes it's not the vaccines given to children, it's the vaccines given to their parents that have affected that child. And you can actually even detox the parents or that child of the parents' vaccines. And that can have a huge impact because obviously not every child on the autism spectrum had a vaccine. There's plenty that have never had a vaccine. There's plenty of kids with ADD and ADHD that have never had vaccines. So it's not that vaccine that they've been given. It's potentially the toxic load from their parents' vaccines that's been passed down that's affected them. And certainly heavy metals is such a big factor because people with like the COMT gene have difficulty processing heavy metals, the MTHFR gene. So then we do have that delivery system of heavy metals injected into the body. And there's no other way that you're exposed to heavy metals in that high dose as an injection because your body doesn't know how to identify things coming in through an injection, and it just doesn't know how to detox it well. One of the other interesting things, is a lot of doctors encourage parents to give Panadol post-vaccines. Now, what Panadol does, it opens a blood-brain barrier, and if you've got heavy metals in there, they get locked in to the brain, and then you've got to detox them out of the brain. So by giving Panadol and Nurofen post-vaccine, you're opening that blood-brain barrier and increasing the chance of it developing long-term issues. So yeah.
And yes. Can you tell us do you work with then kids who are, you're seeing kids with autism, are you working with them and yeah, tell us about that.
So, I mean, with the MMR cease protocol, after the first dose of the first bottle, I had an older child start making sounds who'd never spoken and was nonverbal. So that was really exciting to see that change so quickly, detoxing the MMR from that particular child. Certainly the MMR is all about speech, autism, lack of eye contact, those type symptoms. Whereas the DTaP is more the ODD symptoms, ADD, ADHD, behavioural type symptoms. So yeah, that's a difference between the two of those ones. And then I mean, interesting things that I've seen in clinic over the years. With the flu vaccine, I had one woman that went completely blind after her flu vaccine. And I had another patient who developed severe chronic fatigue after his flu vaccine. So that's certainly some of the side effects I've seen from that particular one. Prior to the COVID vaccine being introduced, the biggest vaccine that caused the most amount of problems and side effects in Australia was the cervical cancer vaccine, which they give at high school. There's 3 of those. And they even have beds at all high schools available because so many kids faint or pass out or develop side effects at the time of being given that cervical cancer vaccine. So that's a big part of, they know that it causes side effects. They know that it causes side effects immediately. So they provide beds in the high schools for kids who start reacting immediately to that one. And, the deaths, if you look at the records of deaths and disability from that vaccine, it was huge. And that was our biggest one that had the most obvious side effects up until the COVID vaccine was introduced. And obviously that's, blown the whole cervical cancer vaccine out of the water. The other thing is with HPV, it's a virus. What happens with viruses? They come and go and the body resolves them on their own like this. So introducing the HPV vaccine, which is only for certain strains of HPV, is not going to have any effect on preventing cervical cancer. Cervical cancer is caused by smoking. All the research on it shows that they've had an exposure to smoking, whether it be them smoking, a partner smoking, a parent smoking, or a grandparent smoking. That's caused the DNA changes, and that's what leads to cervical cancer. It's got nothing to do with the HPV virus. There's no evidence, there's no research on that. But if we can create a story, we can create a vaccine to fit that story, and we can, brainwash enough people to take our vaccine for our story. And obviously every vaccine has a story behind it. The disease has a story. And if you can encourage enough people to believe the story, then you've got a product to go to market. And that's a part of that. So
Frightening, isn't it?
yeah.
Frightening. Tell us about the people that are coming to you, who your clients are now.
Well, I actually just got a really cute message from one of my Astra vaccine damaged ladies. So one of her big side effects was hormonal stuff. And if she misses a period, her symptoms and side effects are really bad. However, every time we have a consult, it brings on her period. And this is before she even starts the herb mix that I give her. Just having the consult actually brings it on. And she just sent me a message, and it's really hilarious because she hasn't even started her herb mix to bring it on again, but she's going to keep that for the next time when it's delayed. Certainly with this particular vaccine, one of the things is long COVID. Now, long COVID, personally, in my experience, I don't see it in someone who hasn't had the vaccine. I only see it in people who've had the vaccine. So I definitely think there's a link there. And some of my patients with long COVID, within 3 days of treatment, they're 80 to 90% better. And people are going to hospitals, they're doing surgeries, they're doing all this crazy stuff for long COVID. And it's super easy and simple to treat. So we treat their B12 deficiency. We treat the viral load with herbs. We treat their adrenals with herbs and do things like NKCP, which works on that whole blood thinning aspect, that they can get problems with clotting post catching COVID or post the vaccine. So, yeah.
Wow. I know a lot of people are concerned about their kids with autism diagnosis and ADHD and ODD. Talked about seeing that coming up through the vaccines and through the parents. But now what's the kind of, I guess, is there treatment? Because you talked about therapies around that.
Yeah. Absolutely. So I'm a GAPS practitioner. So the GAPS diet, Dr. Natasha Campbell McBride has a child who was on the spectrum and started researching diets and gut healing and things that they could do. So that's a phenomenal diet. You can usually see kids with level 4 autism go to level 2 within about 6 to 12 months of following that diet. So kids move from level 4 up to level 2 quite quickly, sometimes even through to level 1 and then no autism diagnosis, and then perhaps like an ADHD, ADHD diagnosis. So they move through all those steps. Now, a child that's been diagnosed with autism, even when they're fully recovered, will always think differently. Their brain will always work differently. They'll always have quirky habits and things that they do, but you want to get the child to a stage where they can work, where they can have relationships. They, even simple things like, people that message me and say, I had a child the other day and they had the child put together a whole sentence when they went into the cot in the morning about like, look at the sunset, mum, it's so pretty. And obviously the child met the sunrise. But these nonverbal children, when they're putting sentences together, it's just phenomenal for the parents to hear. So, that's always really exciting. Not having meltdowns anymore, because as we're healing the gut and the brain, you can reason with the kids. So another child on the spectrum experience where the child really wanted to go to Officeworks. They got there, Officeworks was closed, and ordinarily the child would have had a huge meltdown, but they were able to explain it's closed, and the child had no meltdown, just understood the concept of something being closed rather than having a meltdown. So it is amazing when you see them going from level 4 and then moving back through the stages towards level 1, which is level 1's more of a high functioning mild diagnosis, whereas level 4 is usually your non-verbal, no eye contact, kids with meltdowns and, perhaps self-harm or harming siblings. So, yeah.
So not many people know this about me, but in my previous life, I was a special needs teacher.
Oh, wow.
And, it's remarkable for me to hear you say recovering from autism, because in my experience, parents are not told that they can recover. That there's this is how it is. I've seen actually one of the kids that's at the school whose parent put her on a strict diet. And the teachers kind of laughed. They were like, you're not going to cure autism.
Yeah.
Right. And she was the child who would throw the shoe on the roof regularly.
Yeah.
And then within, a year or two, she had language and was talking and was not having behavior issues. And it was remarkable to see that, but still the brain as a teacher did not suggest that that this was a recovering student. Was just, good teaching methods over time.
Oh, yeah.
So really, you're talking about healing the gut. A lot of kids with autism have quite channeled food options. How do you get through getting your kids to eat differently? And considering that all food these days, when you read the ingredients, they're kind of laced with all kinds of.
Absolutely. So there is a protocol in Dr. Natasha's book about getting kids to eat. There is a whole technique of doing that. There are lots of behavioral therapies. Essentially, these kids think they're the boss of their parents. So they refuse to eat certain foods and will only eat white foods or whatever the texture issues or whatever. It's about not giving them the option that they want, the white bread, the white pasta, whatever it is. The white foods is a big thing with it all. And actually just saying either you eat the healthy food or you go hungry. And I tell you what, when I started doing that with my boys, when they're a young age, in the morning, they eat cereal, toast, fruit, they eat anything because they're so starved because they didn't eat their dinner or they didn't finish their dinner the night before. So then they'll just eat what you serve. I mean, some parents find it a bit too strict and they find it a bit too hard. We certainly can reverse food intolerances as well. There is a clinic in the city where severe intolerances, even like cat dog allergies, 2 sessions, gone completely. And it may wear off. It doesn't last forever. And you may need to go back to that clinic and have it redone. But reversing those intolerances and allergies are pretty phenomenal to see. So then perhaps they can have a bit of the food that's upsetting their gut and brain, and you can still work on healing the gut in other methods, in other ways. So yeah.
Remarkable. We do have some questions coming through.
Sure. So MTHFR is methyl tetrahydrofolate reductase. So it's a gene. You know, some studies show 30%, some show 40% of the population have some mutation on this particular gene. There are two parts to it. There's the C677T or there's the A219AC. You get one copy from mum, one copy from dad. So you can potentially have a double copy of that C677T, and then your detox pathways are very affected. So if you have a double copy, if you have one from mum, one from dad, and you're homozygous, there is some information to show that up to 90% of mercury is stored in the body, and you only have the capability to detox about 10%. So we do still put mercury in the flu vax, and there's one other childhood one, and I can't remember the name of it. They do still use mercury as a delivery system. All the rest use aluminium, because when they decided that mercury was bad, they switched it out for aluminium. If you have the MTHFR gene, you may be more likely to have something like the COMT gene, which makes it very hard to detox aluminium and other heavy metals as well. So they just went from one toxic heavy metal that affects the brain to another toxic heavy metal that affects the brain. So it's just your detox pathways. So that Dr. Ben Lynch, his Dirty Genes book is probably one of the world's best books on the MTHFR gene and on other genes like the COMT gene and other detox genes, so you can understand that. So if you have that gene, if you have a double mutation on the C677T, you are more likely to develop autism after a vaccine. You are more likely to have reactions to vaccines because you don't detox well. So genetically, you're prone to having these issues. And obviously, you do have family history of things like autism and ADD and ADHD. However, you know, if they have this gene and they're all getting the regular vaccine schedule, then of course they're going to have trouble detoxing it.
I like what you said, because everyone is carrying these genes, and depending on your lifestyle and depending on your, you said trauma, but also your positive mental attitude and
absolutely,
all those things can affect whether those genes go into action or not and start affecting you. So you can actually bypass all of those toxins when you keep a positive mental attitude. That's a very simplified way of saying it, right? But you can negotiate the way around that with your lifestyle.
Absolutely. And the fear, people who had fear of having a reaction to the COVID vaccine were more likely to have a reaction than people who had no fear. If people went in with a mindset of, I have no fear, that is very powerful. That belief that it won't hurt you is very powerful, whereas the belief that it will hurt you is also very powerful. So you are more likely to have a reaction if you believe that, you know, if you have fear of something happening, if you think worst case scenario. Absolutely. If you think about something long enough, you will create that reality in your life. I remember years ago, my ex-husband was obsessed with people getting parking fines outside the school or something along those lines. And eventually he parked in the wrong place and he got a parking fine. But it was because he was so focused on the fear of it and worrying about it that he created that own reality for himself. So you can create your own reality. You can create things that will come into your life if you believe that that will happen.
I heard
Yeah.
another story where there was a lab and they were testing all these guinea pigs for all these different symptoms and giving them the injections for different things. And one group of guinea pigs seemed to stay well when the other ones were all getting sick. And they said, well, what's happening that's different with this group? And they eventually discovered that the person responsible for looking after those animals was patting them, was giving them the treatment, but then
Oh,
patting them
the touch, the physical touch. Yeah, amazing.
and that helped them to stay
Mm,
well.
mm,
So there's a saying that I always say that you don't when you're in a situation where you're maybe you're walking home in the rain,
mm-hmm,
right? And you say, oh, I have to walk home in the rain. If you switch it around and you say, I get to walk home in the rain,
mm,
then you actually won't get sick. A lot of people go out
mm.
cold and they get sick.
They have that belief system. Yeah. I mean, if you believe that going out in winter in the cold air will make you sick, you will absolutely manifest that reality. There's no research on that. It doesn't exist. It's not a thing. But people are like, oh, if I go out when it's cold and I don't have a beanie on, I'm going to get an ear infection. It's like, do you like that? Doesn't make sense. There's no logic behind that, but they've created that reality for themselves. And if they do that, then they will absolutely get sick because they believe that that's what is making them sick. And it's, what makes you sick is what you put in your body. I love Stephanie Messenger's book. She's got like Melanie's Marvelous Measles and Sarah Visits a Naturopath, I think the other one's called. And she talks about like asking the kids, like, why do you think you got sick? Oh, well, I've been to lots of parties recently and I've eaten lots of sugar. And perhaps that's why I've got measles or, whatever other illness because of putting too much sugar in my body, not being exposed to a bug. Because I can tell you, we tried so hard to catch chickenpox. And I am talking constant exposure to adults with adult chickenpox, sleepovers. One time, I actually got a phone call from the mum the next day. Her two fully vaccinated kids had chickenpox. My unvaccinated son, zero symptoms. And we went there for the sole purpose of catching chickenpox. So a disease is not something you can catch if your environment, if your body is not susceptible to catching that disease. And the cool thing about this is I've got a friend who I think she's either a grandmother or a great grandmother. And one of her sons died after his 6-month injections. So back then, SIDS used to be run by I think they're called now the AVN, the Australian Anti-Vaccination Network. They had to change their name. But they used to come and visit you after you had a baby die of SIDS. And they said to her, had he had any vaccines in the last 7 days? And she said, oh, yes. I think it was like 5 days prior, he had one, high fevers. They couldn't do anything. And then on that 5th day, he passed in his sleep. But her eldest child had the same problem, but she happened to walk in and catch that child when they were blue and was able to get them the medical help prior to them passing. But she said that she tried to catch all these diseases with her kids, back, she's a generation or two prior to me, and she couldn't catch them either. And her fully vaccinated kids, like, they give us the option. Do you want to send them to daycare? Do you not? There's an outbreak of chickenpox or, whatever it is this week. I would always send them. I'm like, absolutely send them. Hopefully they catch these things that apparently unvaccinated kids catch. No, they can't catch it. We tried. It just doesn't happen. They just can't catch it. So, yeah.
Now that might be coming back to Portia's question around the shedding, right? So if you keep your terrain really well, unlikely that you will catch that shedding, or think that there is now introducing a new pathogen that the body's not used to
Mhm.
can disrupt that as well. Like it's something that the body can
Yeah,
over time build up that immune system too.
perhaps even catching COVID. There's parasites in COVID itself. If you catch COVID, you can get micro blood clots. If you catch COVID, you can get all those vaccine damage symptoms potentially if you catch COVID itself, or the shedding. I guess to protect from all of this is keep your environment alkaline. Like take something like Brassica or greens or whatever you need to keep your environment alkaline in your body. Try to avoid sugar as much as possible. If you're concerned about the shedding and that you've got some stuff, you can certainly do, there's lots of protocols that you can do with NKCP, bromelain, and liposomal turmeric to clear it from the system. Antivirals will clear things from the system if you're concerned about that. The teenagers collapsing and having heart attacks, I guess if most of them are probably vaccinated because, there are kids as young as 2 in Australia that had the COVID vaccine. So they could have perhaps had it years prior. So that could be a factor there. Certainly even the Gardasil, the HPV vaccine, that causes collapse. So that's not just the COVID one. There are other ones that cause collapse as well. And also we have no idea what they're currently using in our water and the skies. Now, whales attacking boats has never happened in the history of whales. They don't attack boats. It doesn't happen. They're putting something in the water. There's something that's happening that's affecting animals. Animals are so sensitive. They pick up on all this stuff. If anyone owns an animal, you can be walking your dog and your dog somehow knows that you're walking past someone with really bad energy and your dog starts freaking out, your dog starts coming to you. Now, this person could be there to harm you, or they could, have done bad things in their life. But for whatever reason, your dog will react to that person even prior to you seeing them. So animals, they're picking up on all this stuff. There's stuff going on. We don't know what they're putting in the water. We don't know, what's going on with the oceans. We don't know what's going on with the skies. But those things that are not vaccines could be affecting these kids. Yeah.
Now, coming back to treatment with kids with autism and so forth, do you look at parasites?
Yep.
Yeah.
Absolutely. So parasites, we can either do herbs, we can open the capsules and they can add it to some juice or some non-dairy milk. Or we do have homeopathics for parasites as well. So we can absolutely do it with our homeopathic if we feel it's going to be difficult to get herbs into kids. And kids on the spectrum can be tricky. Some of them like bland supplements, as in if you try and mix it with juice or something to add flavor, they can be very adverse to that because they don't necessarily like flavor. So that can be tricky. So hiding a homeopathic in water is very easy because you can put the drops in. So yeah.
So obviously you work with homeopathics.
Yeah, so we do work with homeopathics because
homeopathics and what natural remedies.
Yeah, so Toxa Prevent. So this is a heavy metal detox. It's the only heavy metal detox that actually works. There's all this stuff online about people using heavy metal detoxes. All of them don't work. All they do is move the heavy metal from one organ to another. Now, Toxa Prevent is a medical device. It binds the heavy metal and it takes it out of the body for good. All the other stuff that people talk about in the health groups and the other groups and other people, all they're doing is moving it from your brain to your liver or your liver to your heart. They're moving it elsewhere in your body. They're not actually taking it out because they're not medical devices. So you need to do the Toxa Prevent to bind to those heavy metals and eliminate them completely. So
Oh, so
yeah.
you can't use a natural herbal remedy to get rid of heavy metals.
Yeah, herbs will also just bind to it and move it to another organ. They won't eliminate it completely, whereas the Toxa Prevent is a medical device which will bind to it completely. So it's in capsule or powder form. The TGA have just banned it. So very soon we'll have to access it through New Zealand because the TGA are no longer letting us use that one. So
Wow, if the TGA is banning it, then you know it's good for you.
yeah, yeah.
Yeah, then you have to get it some other way.
Yeah.
Okay, and just having a look at other questions in here. And I 100% about water, you know, with the water that we drink is super important. Do you have a recommendation? Do you?
I have a Kangan water filter, which is the alkaline water filter. I've had it for years attached to my tap. It wasn't cheap. I bought it from a friend who does Kangan, and she's now moved on to a different brand. I think a water filter that attaches to your tap is practical because in the past I've had those big, heavy ones that you've got to refill all the time, and that's just time consuming. Whereas one that's attached to your tap is just easier because you just turn on the tap, switch it over to the Kangan, and then you can get it out that way. So it makes it a lot easier. So certainly filtering your water, having alkaline water as much as possible is going to make a huge difference there. So yeah,
well, I have a Kangan as well, and
a Kangan, yeah.
Well, you can't go back with the taste after you've had it. I ruined my husband. He used to drink out of the, you know, anywhere, and he said I ruined him, so he can only drink water now.
Yeah, so it definitely, you know, it changes if you change the alkalinity of the water, you change the taste phenomenally, because you can, even on the Kangan, you can change the pH to what you're using it for. And you can, if you put it on the wrong pH and just drink that, you're like, oh, this definitely tastes different. So
Lisa said, what about reverse osmosis water?
Yeah, reverse osmosis is probably great as well. When I think of reverse osmosis, I think of detox. And I'm sure reverse osmosis is fantastic. I don't know a lot about it, but I always think of it in regards to Epsom salt baths to detox. So sometimes when I'm treating a child, they might be from a separated family, and at the other parent's house, they may not do all the right things with their diet. Now, when these kids come home, the parents will often do an Epsom salt bath and reverse whatever that, you know, the bad foods or not taking the supplements or whatever it was that they had at the other parent's house. And it works phenomenally, but you do only need to stay in it for 20 minutes, because after 20 minutes, reverse osmosis occurs, and those toxins that have gone into the bath water will come back into your body. So that's how I think of it.
Yeah.
But yeah, I don't really know enough about the reverse osmosis and water, but I'm sure it's, you know, probably something similar to like a Kangan with the alkalinity.
Yeah, there's lots of different water companies now, then people want to share their amazing water filters. What's the difference between Toxa Prevent and zealite?
So zeolite just dumps the heavy metals to another organ. It moves them from one organ to another, doesn't eliminate it from the body. Good marketing, you know, fantastic marketing. And it probably has some effects, but does it have long-term effects? Probably not, because you're not moving that heavy metal completely out of the body. You know, whether it be the aluminium or the mercury, or in some cases it can be lead, because back in the day, a lot of cots were painted with lead paint, but people never detoxed that from their systems, did they? So then you're passing it down generationally, and people are just going to have a high load of lead potentially. There's a whole bunch of things that they could have a high load of. So, yeah.
Do you see the heavy metals in your blood analysis?
Not in live blood. You can usually ask questions that determine heavy metal levels. So behavioral issues. If a child has behavioral issues, there's a good chance they've got heavy metals. With adults, I say to them, do you get road rage? If you get road rage, you have heavy metals. They go from 0 to 100. They're not able to cope with changes, with stress. They might have itchy skin. That can be a sign of heavy metals. But definitely in kids, it's the behavioral issues. It's inability to cope when change occurs. So if I want as a child and I don't get it, I have a meltdown if I've got heavy metals in my system. So that's a big factor that you can see there. One other thing with parasites is toe walking. A lot of kids with autism walk on their toes. That's just parasites. And I've given them herbs for parasites and literally seen them go from toe walking to walking correctly within days. So yeah, it's pretty amazing when you see that change by treating the parasite there. Yeah.
That's amazing. I want to know all the questions now about heavy metals. So really the only treatment you said is the Toxa.
The Toxa Prevent. Or Epsom salt baths will bind to heavy metals and take them out. The other thing is infrared saunas. So they're kind of the three things we have in Australia that are fantastic for heavy metal detox that really do eliminate it completely from our bodies. So those things will completely.
How many infrareds do you need to do?
Well, I guess it depends on what's going on for you health-wise. Infrared saunas are phenomenal for cancers. They're phenomenal for viral infections. If you do infrared saunas regularly, you'll never catch a viral infection for the rest of your life because viruses hate the heat. So they can't live in a hot environment. So if you're heating up your body the way you do in an infrared sauna, it's, nothing wants to live. I remember during COVID times when you couldn't do infrared saunas and float tanks, I was able to still access them and do them. And I just thought, my body's just going to not even have anything to do with COVID because it's so detoxed and the infrared saunas and heated up and all of that kind of stuff. So yeah, I just thought that's, they're just amazing to do. The infrared sauna it's definitely tricky. So what I do is when I go in, I give myself a break every 10 minutes or so, jump out, grab some cold water. Sometimes I'll pour cold water all over my head, but to have the discipline to stay in for the full 45 minutes is you have to be pretty resilient and pretty amazing to stay in for that full time. So, but any time you spend in there is going to be having that detox effect. So yeah.
Wow. Now I heard eating papaya seeds is good for parasites, but I was grinding them up and then I heard that grinding them up doesn't work. What herbs do you use for parasites?
So for kids, I like to use the capsules. The brand is Panaxia Gut Bug. So I find that one works very effectively. Liquid herbs, liquid herbs are tricky with kids, but adults, we can use things like wormwood. Obviously, wormwood works on the identical pathways to ivermectin. And so a lot of people took wormwood because it will have the same action as ivermectin. So you're going to get that antiparasitic effect on the body and work on stealth infections. There's Chinese wormwood as well. So it's a different strain. You can combine the two together, and that's phenomenal for parasites. So yeah.
Has ivermectin become controversial lately? I thought it was they said don't use it, and then everyone was like, well, you do use it. And then some people in the freedom community like, now don't use it. So now I'm very confused.
Well, see, ivermectin, I've had some interesting things with it. One of my patients has had prostate cancer for years, but prostate cancer, if you do nothing for prostate cancer, you'll probably die of old age before you die of prostate cancer. So it's a very slow growing cancer. It's like some breast cancer. Some breast cancers are also very slow growing. And if you do nothing for it, you'll probably die from old age. So some of them, they're slow growing cancers. They take years to grow and have a significant effect. Now, he was taking ivermectin every day as a preventative for catching COVID. He was also doing my COVID prevention protocol as well. He's never had COVID, but recently he did some PSA testing and some other scans. He no longer has prostate cancer. And I put it down to the ivermectin because it must have treated his cancer. And that's, I guess, something that we're learning about it, that it's good as a potential cancer treatment. I don't know whether it's bad. I mean, I don't know whether you should just take it for the sake of taking it. You know, I guess if you do have cancer or you do have something that it's indicated for, then it will have a great effect. There are some new studies on it for long COVID. So I guess if you have a reason, you could take it. I mean, I've never taken it. I've never felt that I had the need to take it because I've got all these great herbs that I feel that have very similar function in the body. And also I take a whole bunch of herbs every day that are specifically cancer prevention herbs that work specifically to prevent certain cancers and ones that my mum, you know, died from. So you can work with specific herbs to prevent them, or you can take ivermectin. Whether it prevents cancer, I don't know, but it's certainly in this case, he now no longer has prostate cancer, which was exciting. So yeah.
Now going back to the bath, an ideal bath to have with, you know, you're saying Epsom salts. Is that the same as all Epsom salts magnesium based? Is it there's bicarb soda bath? Is that two different things?
So you can add the bicarb to the Epsom salts. Usually the dose is 3/4 of a cup of Epsom salts, and the bicarb usually do 1/4 of a cup of that, and put that in, put a 20-minute timer on. Ideally have the bath as hot as possible, but obviously with kids, you're not going to have the bath too hot because they'll be uncomfortable. And then put that 20-minute timer on. After 20-minute timer goes off, you hop out. Now, the problem with this is some practitioners prescribe huge doses of Epsom salts. I've had people being prescribed by a naturopath 3-4 cups of Epsom salts, and then they faint because it's detoxed too much of the heavy metals, and they're trying to get out of that bath and they're passing out because that changes too much for them. So you've got to be careful only to use 3/4 of a cup. Don't do the baths more than 3 or 4 times a week. If you do them too often, you can get a detox reaction. So I guess it's about what you can do. If you don't have a bath, you can do a foot bath. Any bucket you can stick your feet in, it will have the same effect. Lots of people have only showers now, don't have a bath. So just do a bucket, or you can buy those foot spas from Kmart kind of thing. So yeah.
Amazing. It sounds like it's a good thing to do but yes, as often we can. So you sell the Toxa Prevent, or can we order it online? What's the how?
Yeah, you can probably still get it online. Now it might be tricky because I know they're not allowed to order more stock because the TGA rules. So I know that most companies are discontinuing it September, October of this year. So it may be hard to get after that, which in that case, I'll just be getting it from New Zealand. So yeah.
Oh, there's a good question here about the float tanks. So we hang around in a float tank longer than 20 minutes, so that we should not be.
Or it should only be 20 minutes. So if you're doing it for therapeutic reasons, for detox, it should only be 20 minutes. And so with those float tanks, my pain is often worse for them, whereas my pain is better for the infrared sauna, because infrared saunas are done correctly for 45 minutes. That's done for the correct time frame. The float tanks, you're in there for too long. It should ideally be 20 minutes. So I don't know how they determine that. Yeah, I don't know how they determine that or where they're getting that from, but that's incorrect to have that therapeutic heavy metal detox effect. So yeah. Yeah, and it's funny because I've had a hip replacement and I've spoken to other people who've tried the float tanks and followed them as per the 1 hour, and their pain's actually worse afterwards. Whereas if they do the infrared sauna, their pain is better. They get pain relief from the infrared sauna. So
okay. Personal question then, because my mum has just had a hip replacement this week.
Yeah.
And you just said you had one. Good protocols for healing?
I guess post-surgery, there's a product called Tissue Regenex by MediHerb. that gives you 12 weeks of surgery healing in about a 2-week period. So you can go back in for your 2-week checkup, and the surgeon will think you're there for your 12-week checkup. You know, your scar looks phenomenal, your healing looks amazing. I got approval to drive 6 days after getting my full hip replacement. I was riding a bike maybe 6 or 7 days afterwards. I had 1 day off of work. I had 1 night in hospital. So if you want to be sick, be sick. If you want to take a long time to recover, take a long time to recover. But you don't have to. Like, you don't have to be unwell or sit in hospital or whatever. At 5 o'clock the morning after my surgery, I told them I'm leaving that day. I said, I'm ready to go on my merry way. And I'd spent the whole night sneaking out of bed, and I took off those. They give you these compression things in hospital to stop blood clots. And it's this thing that goes up and down your calves. And they were so annoying, I just took them off because I was like, that's really annoying. And you can't get in and out of bed if you've got that. And then in the morning, a nurse arrived to shower me and get me all ready. And I went and showered myself and came back out. And she goes, oh, I thought you would. And I'm like, oh, to be honest, I've been sneaking out of bed all night. So, you know, just, I couldn't even work out how to get that button to work for pain, because I think I lost the button at some stage. So I just gave up on it.
What is that thing? Is it a thing you rub on or you take, or
tissue regenix? Oh no, that's a tablet. That's MediHerb tissue regenix. So that's for wound healing. Things for nerve regeneration, like the poic acid, are great to regenerate any nerves that might be damaged there. Magnesium, CBD and THC for pain relief. Because the problem with the meds that they give you for pain relief is you can't drive on them. And if you try and drive on them, you'll have an accident like I did. So if a policeman pulls you over and does a drug test, you can drive on all those pain meds they prescribe post-surgery. But your cognitive function is not there. You cannot judge a curve. All of those cognitive functions do not exist. Whereas if you use CBD or THC for pain, you still have correct cognitive function. You can still talk to people. I remember once I took one of the pain meds and my auntie was here helping me out with everything and the kids and stuff. And we were all playing a game together. And I was like, oh, my brain is fried. Like I can't, it's like I couldn't concentrate on it. Whereas if you use CBD or THC, you can still concentrate and use your brain. Whereas on the pain meds post-surgery, the ones that they prescribe, your brain does not work on them. So
no, not worth it, because you don't know what's crossing that blood-brain barrier either.
Yeah. And there's lots of doctors that can prescribe the CBD THC now. You can look, I've got a fantastic GP locally who can prescribe it. You know, most of them, it's only $30 out of pocket to see them. So there's not, it used to be you had to pay a lot to see a doctor that could prescribe that. Now a lot of GPs have done the training and can prescribe it. So that's fantastic. We all have receptor sites. So we can all get benefit from CBD or THC. So people have fears and stuff. We have receptor sites. It binds the receptor sites. It gives you the relief that you need, and the therapeutic action that you need. 1% of people have a gene where if they have any THC or CBD, they will develop schizophrenia. However, those people can develop schizophrenia from a traumatic event. So anything that's traumatic to them will switch on the gene for them. So it's not just that. So people worry about it. Oh, my child developed after this. Yes, there's a good chance your child would have developed it after any traumatic event because they have that gene. So that's a problem, is people have a fear because of that gene, but other things can trigger it, and a traumatic event can trigger it. So yeah.
Okay. What is the optimum diet for someone who is on the spectrum? Or
so I mean, I guess it depends on how quickly you want to recover your child. The best diet is the GAPS diet because it heals the gut the fastest. However, some people look at that and they go, it's so overwhelming. I can't imagine doing this with my family. So in that case, they could start with a gluten-free, casein-free diet. So that's removing all dairy and dairy-containing products. So that may be easier to start off with. Usually what I do is combine one of the diets with the hair test for 500 foods to find out what foods are intolerant to, and take out those specific foods that the child's reacting to as well, to speed up the healing. Some of the kids that I've seen recover from quite advanced cases of autism, like your level 4, they've combined the GAPS diet with the hair test to remove the foods that way. You know, some parents will just buy the GAPS book and do it themselves, which is amazing. So, you know, you don't necessarily need a practitioner. You can buy the book, do the research, find out. There's lots of GAPS pages on Facebook that you can join. You can read other stories, that kind of thing. So, yeah.
So if someone comes to see you, what should they bring? Anything with them? Should they?
I mean, if they've had blood tests, that's phenomenal. A lot of kids I see with blood tests that they've gone to a pediatrician or a GP, they've said there's nothing wrong with the blood test. And I'm like, can you bring those blood tests in that they said that there's nothing wrong with? And we often find several issues that we can treat immediately. ADD and ADHD, most people with that are iron deficient. And of course, their brain's not going to work if they're iron deficient. So you're trying to tell someone to concentrate who's got an iron deficiency, of course they're not going to be able to concentrate. So you treat the iron deficiency, and it can be sometimes that simple to reverse that. So yeah.
What do you know anything about the hair strand test?
So the 500 foods hair test that I use is through Queensland, and that's for food intolerances. So that's great to determine what foods they're reacting to. The other hair test people may be thinking of is a heavy metal hair test. You can do a hair mineral analysis through interclinical laboratories. That's probably the best one, and that will determine heavy metals. However, heavy metals can hide in the bowels, they can hide in the brain. So that hair test is one way of determining them, but they can still have heavy metal load, and it can be hiding elsewhere and not be showing up in their hair.
Now, iron infusions, we had a question come through about that. I get a terrible reaction from iron infusions, and I have historically low iron. So I've just completely gone off iron infusions. But what do you say?
So if you got a reaction in the past, iron infusions have actually changed. Where I go and where I send a lot of people, they flush saline through your veins post the iron infusion. Have you had that done?
Yes.
And you still get a reaction?
I get flu-like symptoms after, well, and both times.
And you've got the flu-like symptoms. So it could just be a problem with your detox pathways because you're getting such a big iron load, and you could potentially do a bit of a liver detox leading up to it to support your detox pathways for that excess iron. Because I guess there is a disease called hemochromatosis, and then we get excess iron with that. If you get an iron infusion, you're getting a huge dose of iron in a very short period of time, and perhaps your liver just can't handle that load. And doing a bit of a liver detox, taking some herbs for liver prior would be a good way to prevent that, the flu-like symptoms. So, yeah.
Okay, because I was just thinking the hospital was doing something awful. Maybe not. Maybe it's just me then. Okay. All right. So we can go back to trusting iron infusions in general.
Yeah.
Okay. A brand of iron to give a child with autism?
So, I mean, I use practitioner only one. I use the Biohem from Biomedical. Like over-the-counter ones, I guess you can try something. I'd suggest go for one from a health food store, go for a practitioner only one, rather than your over-the-counter ones, your supermarket ones. I used to work in stability testing, and some of the worst quality vitamins on the market were things like Blackmores in regards to stability. And people talk about these gold standard ones. And when you've worked in stability testing, you can see that these ones that they market well are not necessarily good quality brands. So definitely going for a practitioner only one, you're guaranteed of a much better quality brand of product. So yeah.
100%. Anything sold in the supermarket has got to be, in my mind, it's got to have lots of chemicals so it can sit there in the supermarket. So yeah, we try to go to direct as much as possible. Floridex. Is that another one that's kind of...
So Floridex is great for kids because it's a yummy liquid iron. So it's nice and delicious. So they usually will be happy to take it. If they're a kid that will take juice, see, some kids on the autism spectrum will not have juice. They will not have things with that kind of flavor. So it kind of has a bit of a honey juice type taste to it. So if your child's good with honey, if they're good with juice, they'll probably like it. But if they're not good with those, they probably won't like the taste of it. So that might be tricky. Spartone's pretty good because it's quite flavorless. So Spartone's easy to get in because it is, it doesn't have a flavor. So it tends to be able to sneak it in things more easily. So you could definitely do the Spartone. I saw one question that said, how long do iron infusions last in the body? It depends on what's happening. If you're getting heavy periods, it might only last 3 to 6 months because you'll be getting rid of that iron every month with a heavy period. If you've got malabsorption issues, gut issues, if you're celiac, it might only last 3 to 6 months if you're still consuming gluten or traces of gluten. If you're a celiac, you need to have 2 separate toasters at your house if other people are consuming gluten and regular breads and that kind of thing, because you'll get trace amounts through your toaster. So if you're doing it properly, you need to really do it properly. And also healing the gut, because you can definitely reverse celiac disease if you start something like the GAPS diet, bone broths, and gut healing as soon as the celiac symptoms start, or as soon as that cilia start to lay flat. So you can get it back up again. They've done research on that. So that's pretty exciting.
Genevieve, there's lots of ways that people can take control of their own health, and they can do lots of study and lots of positive thinking and all these good things that people can do to really support their own health. Where do you come in, and where do you feel like there's so much that you go the next level on, that people need that?
I guess kids on the autism spectrum, lots of parents get really overwhelmed. And so I guess having a path of, we're going to reverse these vaccines, we're going to do the CEASE protocol, we're going to look at their food intolerances, we're going to do their diet, certainly things like chiropractic work. I was talking to a lady today, and we both really feel that her son's autism was birth trauma. She was in labor, she was quite far along, but her obstetrician was on holidays and wasn't going to get there. So they gave her something to slow down the labor, and her son turned. So he went, well, you're slowing down the labor, I'm not coming out. So that birth trauma of like, the child's about to be born, the child there, but then they're going to turn. Of course, that's going to affect that child. Chiropractic work can do a lot on those primitive reflexes and things that should close at birth. And chiropractic work can definitely be phenomenal to help aid in your autism recovery. We don't call it cure because it's not a disease. All it is their brain works differently, and you've got to recover that brain to the point where they can speak, where they can get a job, where they can have relationships, all of that kind of stuff. That's all we're aiming to do. And we're not aiming to cure it because it's not a disease. As far as I'm concerned, it's just the way the brain works differently, and it's recovering them back to the person that they should be. And with the hair test, the interesting thing is I remember some children don't have a diagnosis. They have all the autistic symptoms, but when they present to the pediatrician, they can't get a diagnosis, or some parents don't want one. And when we did the hair test, the mum said, this is the child that I always knew was there, but they were under a fog of food. So if they're eating food they're intolerant to, they'll be under that fog. there is a disease called celiac disease of the brain. We do not test for that in Australia. If you take gluten out of some of these kids' diets, they will look up and it's like they've seen the sky for the first time. It's like they've seen birds for the first time. They were under that fog of gluten and they literally could not see under that fog, and it affected their brain. But we do not test for celiac disease of the brain in Australia. So, plenty of kids have it. You'll see kids have gluten and then have all kinds of behavioral issues, and you'll be like, well, probably celiac disease of the brain. But we do celiac disease of the digestive tract in Australia, and we test for that. And some of them may have that, but some of them may not. So, and to scope a child, because the only definitive diagnosis is a scope for celiac anyway, and lots of people don't want to give their child an endoscopy or colonoscopy anyway. So, yeah.
Oh, you just are ticking a whole lot of boxes in my head.
Yeah.
Yes. And a lot of these things I will come to you and we'll talk about them. Certain things I'm seeing. So, it's been an amazing conversation. The time has just flown. And we've covered a lot of ground. So thank you so much.
That's all right. No worries.
And there are probably some other questions that have come through. But what we'll do is we'll wrap up now. And if anyone wants to, stay on and ask any questions, I'll give people the opportunity to do that. But thank you so much, Genevieve. And now let's just tell everyone, how can they find you? Do you only see people in person? So
I do Zoom. So today, just before this, I was Zooming with a patient in Germany. I have a patient at the moment in Ireland. So I see people all over the world. And so we do Zoom, we do phone consults, and I have a clinic at Quakers Hill in Sydney and North Rocks in Sydney. So they can see me face to face at either of those Sydney clinics. Do
you want to leave a email or a website or
yeah. Do you want me to type it in?
Yes, please.
Yeah. All right. So my website is getwellwithgen.com. Wellwithgen.com. That's my website. My email's getwellwithgen@gmail.com. But yeah, that's my website, and people can book online there if they wanted to come and see me. And I love seeing people face to face. During both lockdowns, I continued to see people face to face, even though we weren't technically supposed to in one of the lockdowns. In the first lockdown, it was considered a grey area. In the second lockdown, they were giving fines to naturopaths for seeing face to face. And when one of the reps contacted me and said that they'd gotten a $12,000 fine to this clinic, I thought, oh, maybe I should just go 100% online. So that was towards the end of the second lockdown. But I do prefer seeing people face to face. I find that you can pick up on things that perhaps, and I can't do live blood via Zoom or phone. So if they're able to come in, we can look at their blood. So
amazing. Getwellwithgen.com. And spell that Jen with a G, not a J. Thank you so much for coming on tonight.
That's all right, no worries.
And since you're local, we hope to see you at the summit. Do you think you can?
Yeah, well, I'll definitely be there. I think you wanted me for the Friday, so I'll definitely be there on the Friday. But I'm really excited about the bush dance, so I think I need to definitely be there for the bush dance, because that was my highlight when you were discussing all the different parts of the event. I'm like, oh, bush dance. I grew up in Orange, so bush dances were a thing that we did on a regular basis. So I love a good bush dance. So
love it. And we have the best guy. He comes all the way from Victoria to call our bush dance, and so yeah, because like that used to be done in school so much, and you don't get it these days. So yeah,
my children have never discussed a bush dance at their school with me.
Exactly. Not the old Aussie bush dance. So Trip the Willow. Excellent. Love it. So thanks, Genevieve, so much. And do come along, get your tickets to the Freedom Summit live, the 18th to the 20th. We'd love to have you there, everybody. Yeah, and also we'll be back in 2 weeks' time. We have another great speaker, Dr. Diana, who actually works with teens and really helps teens get through this really difficult period. Look, she works with all kinds of people, but she's been seeing a lot of teens at the moment and working with identity crisis. Yeah, really healing people with what we're seeing going on in the world, and all the agendas that we're seeing going through schools, and kids really concerned with who they are. It's really, so maybe, you know, being able to detox these heavy metals might be able to clear up a lot of concerns about, you know.
Absolutely. I help with clarity of who they are. But I just think, remember us at high school, we didn't know who we were. We didn't fit in. We didn't then become a different gender. We just were who we were.
That's right. And these days the schools are encouraging kids to question and become a cat if you want to. And there's something that that's very difficult. So anyway, we'll be back with that in 2 weeks. We've got so many great speakers lined up for you all. So Maz says she's got to learn to put up a tent so that she can come to. Definitely, we'll help you put the tent up, my love. Gotta get those tents out and prepare for being resilient. So
yeah,
lovely. All right, we will see you again soon. And thanks, Genevieve, for coming on tonight.
Thanks, Kelly.
All the best.
Thanks for having me.
I'm Kelly Wilkins from My Self-Reliance. Welcome to the My Self-Reliance Expo 2024. We are so excited for you to come and experience our speakers, workshops and store holders. There is so much in store for you today.
It's beautiful. Absolutely stunning. It's going to brighten up any room, right? Absolutely stunning. Going once, going twice, sold. 15 $15 right now. Simon's winning. Sold. Well bought, man. Well bought.
If you like what you've seen here, come to our My Self-Reliance Festival. Save the date, 18th to the 20th of October. We'll see you here.